Happy New Year and welcome to another episode of the Veterinary Roundtable, the podcast where we answer your veterinary-related questions while having some fun along the way. If you enjoyed today's episode, be sure to leave us a review on your podcast provider of choice. And if you have any feedback to offer to improve the Veterinary Roundtable, please let us know.
Okay, where's that hammer?
Okay.
I don't have it. I'm
You
sorry.
didn't bring the hammer? Did you bring the
Dang
mystery
it,
bag?
Devyn.
No. All right, let's
I'm
the
done.
podcast is over.
Sorry, I was telling
Okay,
him,
listen.
like, it
I think
needs
we
to be-
rotate the
no.
mystery bag.
Yes, that's what I was saying. It needs to be
You don't like the
spontaneous,
pressure.
a surprise. Like when it speaks to me, I'll bring it to surprise you guys.
The
But you can't just
financial
expect it
commitment as well.
Expect it every time.
Okay, well, then I think we should just rotate the mystery bag.
Maybe we
Or
should
we
do
can
it like
do
once
that.
a month.
No, that's not
And we
enough.
rotate
No,
it.
no
let's
fun.
rotate it because I deserve to experience it
You do.
from someone else.
You do.
That's
Yes,
true.
ma'am. Okay, sure. That's
it's like
true.
the big comfy couch. Anyone watch that show back in the day?
back in the day.
It just gets old after a while, and she keeps pulling things out of the couch.
couch.
It's like,
Yeah,
we get
yeah.
it.
And like
you have
I
things
had,
in your
yeah.
couch.
and I had
It is
Christmas
big
and
and
New
it's
Year's.
comfy. Okay.
Christmas and New Year's
Whatever.
were easy, but now like
Nobody has a big couch like
Okay.
you. Okay.
who's
Nobody
up?
has secret stuff in their couch.
With a talking doll next
That's
to you.
it.
Okay.
Well, they're passionate about that.
No, it's just from when I was when
Okay,
Harrison was
who
growing
gets
up.
the bag next? I need like a
gosh.
baton to
I'll
pass.
take it.
Okay.
Give it to me.
Volunteer.
Wow.
We love the
Here's-
volunteers.
Okay.
Okay, that was really funny. All right.
Life's
Listen,
here.
we also because I always cry when I
You're
laugh.
on one
Okay,
today.
okay, we are up on podcast
Yep.
reviews.
Yep.
And we are almost halfway to our goal of 100 on Apple.
Almost
Mhm.
halfway.
Almost halfway, which means
Almost
we're
half-
almost to halfway, which means once we're halfway, we're almost
Which was
there.
where we're there.
So
Yeah.
that's
We're at 40
yes.
right now on Apple, so keep them coming.
We need
Keep them
100.
coming, and then on Spotify,
Yep.
we're like
128.
128.
What
I
was
don't
our
think
goal?
we're going.
Goal
Well, I
for
didn't-
Apple's 100.
No, for Spotify. We didn't have
Harrison,
a
do
goal.
we have a goal? For
I don't-
Spotify.
Nah, we'll just go with Apple.
We're going with
It's
Apple.
Too many numbers.
Okay, cool.
Too many
That's
numbers.
60 people. If 60 people say something,
And I know we got 60 followers.
Yes.
So
Okay, so and we still do not have. We have a couple of suggestions for Devyn's what she's going to do when we
Mhm.
get to 100.
we should just keep them to ourselves now so people can just listen in and see what we decide.
Oh, well, see, I think they should know because then they're going to be like,
I don't even
oh,
know.
hell yeah,
We
I'm
don't
going to
even
do
know
this.
either.
Let's make
That's
her
true.
do this.
And we want them to comment ideas.
What if
Yeah, we
it
do.
was trying all the different dog foods?
That's a good one.
Dry and canned.
all
Oh,
different
that's-
kinds? What do you mean? There's
Just
like,
cans.
Like the ones
Infinite.
that we have in the clinic.
Yeah. Your 4 favorite.
well,
By
personally-
smell.
Personally, I
By
think
smell.
CD's
Texture
the
and
best.
consistency.
By texture and consistency. What do you think is the best, ZD?
No, I was just messing. I
Oh,
said
you're
CD, but it's probably ID.
If
think
you-
about
if
it.
some
or
of us-
AD is supposed to be.
Oh,
really
And
Oh,
some
yeah.
of us
Oh.
in treatment when we
AD,
get
could you imagine
urgent
trying
care.
to that? It'd be like it's pudding
got-
and then you'd be
yeah, you
like,
could just swallow. You don't
I
have
got
to chew
shivers.
it. I'll let you know. ID smells pretty good if you're really hungry.
oh no.
The turkey one was fat.
It does
think it's
look
a
like
turkey
turkey
one.
gravy. I mean, it looks
Oh,
like something put on
gosh.
mashed taters.
Okay, so that's
Okay.
an idea. There you go.
To be
There's one.
determined.
I like that
Okay.
Tasting food.
I'll jot that down.
Jot that down.
Take into
Um,
consideration.
Yeah, we just have to come up with some more clever
Okay.
ideas.
Okay.
Okay. The
Okay,
milk
cool.
mile was the other one.
Yeah, which
Oh,
is
yeah.
hysterical.
We don't even have a track. I mean, there's
We'll take
Westfield,
you
but
to a track.
you can run around the parking lot. Great, even better.
Gosh, that's
Or
just-
she could race somebody, a dog.
You know what we should ever do? Here's you remember that video where I had to eat stale Cheez-Its and race Phyllis?
Yes, I just watched that last night.
Maybe she should eat stale Cheez-Its. That was disgusting. I had to eat off the ground.
We've already
I
had you
raised
do
2
it.
dogs.
You raced 2 dogs. There you go.
Yeah.
Who won that?
Me.
Oh, you did.
I beat
Yeah,
both
Phyllis
dogs.
didn't know what she was doing.
I
Way to
beat
go.
Phyllis and I beat
Serious?
Sirius.
Oh my gosh, that's hilarious.
Mhm. Okay.
I don't know. That dog food one's pretty good.
Anyway.
Okay, before we get too much further, we need to introduce ourselves.
Oh gosh, yeah. Okay. Well, every time I say something about yourself, it's
You've done it
obvious-
twice,
it's-
so we've all
I
done
know.
it.
I know. Well, you guys thought it was dumb.
We never said it was done.
Okay, well, someone else go first. You can set the precedent.
Okay, I am Emily King, and I'm a veterinarian. And my favorite color is orange.
Oh, good one.
I
Okay.
don't like being put on the spot. I'm Courtney, and
What do you do in life?
I just got back into coloring and I really like it. And it makes me happy.
I meant, what's your job? You're the
Oh,
technician.
She's a colorer. Artist.
Okay.
I'm an artiste. Coloring books. Yeah. What do you do? I color. No.
No.
You're a vet tech. Oh.
my God.
On the side. I take care of animals as well.
There we go. There we go. We're
Okay.
getting there.
Whew. I'm Devyn. I'm a vet assistant. And
In training, technician.
yes,
In school.
tech and training.
There you go.
I finally did my farm final last night.
Ooh, how'd that go?
It was proctored, so like they were watching me and listening to me,
Really?
and it went pretty well. I don't have my grade back yet because it was all free response, but I feel pretty good about it.
So like they just
Nice.
asked you questions and you had to respond? It wasn't
no,
writing.
like it was writing, like on the computer. Like there was a
Okay.
question, I had to type my answer. There was some math, but I feel
Why'd they watch you?
to make sure I'm not like using notes. Yeah.
Do they go
so
into your
weird.
computer screen and like
yeah,
make
so
sure
like they
there's
can see
no-
like what my screen's doing.
So they weren't like physically watching you. They were just
No.
okay, I get it.
Well,
now.
no, like there's a camera on me,
Mm.
then they're screen recording my screen, and my microphone's on.
Ooh,
yeah.
that sounds really
That's
like
very
legit.
daunting.
Yeah.
There was a timer.
I'd rather just go to a building and do a written test.
I know there was that
like-
option, but it took 4 weeks to set up. So
Oh,
I was
shoot.
just gonna, yeah.
No,
But yeah,
that-
I feel pretty confident about it.
Nice.
Good
Good
job.
for you.
Way to go.
Yes.
What was
It's always a
what was
way
the
off.
hardest question you got asked?
There is a question. Okay, this is gonna sound bad, but there was a question. It asked me to name the 4 fat soluble vitamins that like I kind of remember learning, but completely forget. So I guess.
I'm not gonna say that I remember those. Okay.
So I guess
Oh,
I
okay.
said vitamin A, B, E, and K. I'm
Oh,
like
good
giving
job.
people answers, and then I looked it up after, and it's A, D, E, and K. So I got 3 out of the 4.
Oh, nice job.
So
Okay, way to
I feel
go.
better.
I would have been like,
Nice.
No, literally
yeah.
on the camera they could see me going. Yeah, but I feel good about it. So
That's terrific. That's
Good
great.
job.
Good job.
next is my externship, so I
Woo
can
woo.
start my paperwork.
You're not going anywhere, are you?
No,
Okay.
no,
Externship here.
no.
Wow.
Yes,
Okay.
for
Thank
sure.
goodness. Okay. I'm Dr. Ashlyn Duckwall. I'm a veterinarian. And I had to run outside with wet hair in my jammies because my barn cat got out of the barn last night.
Oh,
And I
no.
saw it on our camera. And I was like, ah! So I
How'd she
ran.
get out? Through the
She
duck-
jumped the horse stall gate and then got out the stall door. Yeah.
Uh-oh.
Listen, she
And then
just-
I was like, it's okay, kitty, come here. She's trotting away from me and then
Mhm.
went in the way she came out. And I'm like, it's okay. Just come in the front door. Yeah.
Oh, Napa.
why did you want her in at night? Just because?
Yeah, I love her. She's so sweet.
This
doesn't
is
go
the one who
outside.
loves the
Yeah.
rabbit.
She doesn't
Yes.
go
She's
outside.
a sole barn cat. Like
Oh, she just stays in the barn.
She
Like,
doesn't.
she never
she's
goes out of the barn.
negative. But they also have a massive barn.
But I know they have a massive barn, but like, she doesn't.
I
Ever,
know.
she doesn't want to go out and like.
She's curious,
think
but
she
she's
is
also
too.
content.
She's happy because she
she?
has her rabbit friend.
you
She
just want her
snuggles
to
with the
stay
rabbit.
safe.
She loves her rabbit.
She's so sweet.
She is sweet.
She's so sweet.
Well,
So-
that's
was
good
her-
that she came right back.
Do you remember what her foster name was?
Muppet.
Oh, that's a funny
Muppet.
name.
Yes. That was her foster name.
She's cute.
Okay. Let's go to icebreakers, shall we?
Let's do it.
What conspiracy theory do you secretly believe?
Believe is the
do you
word.
Believe
Oh gosh.
Oh.
Oh.
Holy cannoli.
Okay,
Okay,
no.
believing is a whole nother challenge.
Let's just change it.
Let's just say
Okay, what?
Okay.
A
Let's talk about
conspiracy
it.
theory you'd like to talk about.
Yeah.
Okay. Okay. Yeah, because like, let's just preface this with I'm not sure I believe these.
yeah.
No, yeah. They're just fun.
They're just fun to talk
Fun to
about.
talk about.
And funny sometimes.
Mhm.
Okay, let's go first. I think Courtney wants to go first because
Yeah.
she's stressed. Someone else.
Okay.
Yes, Courtney, you go first.
We did not land on the moon.
Ooh, that is a
Mm.
popular
So that's your
one.
claim? Like
That's
you
the
believe
conspiracy.
that? I kind of actually do believe it.
That we
I'm not
never
gonna lie.
landed on the moon.
Yeah. Why haven't we been back? Do you know how amazing the technology is now compared to when we did
Because
go?
it doesn't serve any purpose to go back.
Well, it might.
Our flag's already there.
Is it? Haven't you seen the picture? Is it there? Is the flag actually there?
I don't know. I
We got to
assume
replace
so.
the flag.
Why haven't we? Have we
Has
went back to
anybody-
space at all?
Has anybody watched the show on
In the
Apple? Man,
ISS.
Yes,
Yeah.
for all mankind.
there you
The
go.
season finale is tomorrow. Tomorrow.
Okay, I
It's
haven't
a
watched season 4.
It's great.
What is
Season 4 has been really good.
What is
Well, for all mankind, it's
It's a
like about
spaceship.
how like as if it's kind of like
they set up
fake history, but
Yeah,
there's historical stuff in
Yeah.
it, but then there's fake history. So like
yeah
as if they kept going to the moon.
Mm.
So like
and
what would
Mars.
have happened and Mars?
Yeah.
Yeah, that's interesting.
it's really
but
good.
anyway, so you don't genuinely don't believe that we went to the moon.
Kind of not.
Like you know better, but it's still intriguing to think that we
Yeah.
probably didn't go to the moon.
Yep.
Gotcha.
I think we went. I'm
Yep.
confident.
You're
No
confident.
comment.
Okay.
No.
You don't have an opinion?
I just haven't thought about it. I just
Yeah.
assume we went.
Yep. Me too.
Okay.
I
assumed
really
we
just
went
don't
too.
think about it.
I didn't until I just read it.
Okay.
Okay, Devyn.
Aliens.
Just
Do they exist?
aliens.
What do you think about them?
Mm.
I think they exist. Maybe not like as prominent on Earth
Right.
as people
Yeah.
kind of make them out to be. Like, I don't know about the whole Area 51, like them doing procedures on aliens there, but I definitely believe in them.
I mean,
In the
universe
universe.
is so large. I
Mhm.
just think
it's overwhelming.
yes.
Yeah.
That it's reasonable to
Yeah.
think there's other life out there.
Yep. Probably so. I don't know. It's so hard to know.
I know.
You never know. You never get all of the information.
Nope.
Yeah.
So someone knows, but
Someone
they're
knows.
not telling us.
We're aliens to them.
This is true.
Mm-hmm.
Yep. Very
Okay.
fascinating.
Good talk.
Okay. Cool.
Aliens is oh boy.
Glad we got that.
Because you get the whole UFOs.
Yeah.
Yeah.
The weird stuff that happens in the sky.
Yeah.
Mhm.
It's like people swear by it that there are UFOs.
Did you guys
Yeah.
see the Starlink in the sky a few weeks ago?
No.
Maybe like a
The
couple
what?
months ago. I think like Elon Musk like launched a new Starlink thing, and in the sky there was a line of dots,
I
like
heard about
colorful
that.
dots that
Yeah.
people thought were UFO things,
And they
but
were really Starlink.
it was just a
Oh.
Just Elon
thing
Musk.
he launched. Just him.
Just Elon Musk doing his thing. I don't know.
Yes.
Yeah. It was crazy. Look at
Fascinating.
pictures. Yeah.
Then I never know if those pictures are real. You know, it's like, is it edited to start something?
Is the flag
Yeah.
actually on the moon?
Well, I only know it's real because my neighbor showed me a picture he took. But yeah.
Is it Photoshop?
Well, now though, with
I don't
all
know.
that stuff, you can put people in places that
Yeah.
Yeah.
you didn't, So like,
You know what I think is
looks
too
real.
much? AI.
Yeah, that's what I mean.
Yeah.
the
It's
AI
really
generated
taking over the
pictures.
world. That's
Yeah.
too much.
Yeah.
They're doing too much with that.
Okay, mine is that birds are cameras from the government watching us.
Wrong.
I think birds are real. I
Okay.
think it's a
I
real
mean,
animal.
I'm
I'm sure that the government has made some robotic birds that are actually cameras, but I don't
Yeah.
think all
Not
birds are
all
cameras.
birds. Maybe some.
Or they
in the
trained a
flock.
bird to carry a camera.
Like in important
around.
areas, I'm sure
It's on
like,
its chest.
they have a bird sitting. Mm.
Why do they
But-
need a bird? They watch us through our phones.
Yeah, watch us
That's
everything.
true. Yeah. Birds no longer needed.
We're advanced. now.
We're advanced. That's right. Mine is that I heard from one of the doctors, I won't say, in the office, that someone in her family still believes that the earth is flat. That is not really round.
Okay.
So
What's your opinion on that?
And it's called something. I think the earth is round.
I would agree with that.
But some people say, nope, that is not true.
Why do they think it's flat?
I don't know because I'm not one of those people.
Yeah, they
But-
have some pretty good reasons. I mean, I know the earth is round, but
Why do they think it's
they
flat?
support their I don't know them off the top of my head.
Oh.
But
Interesting.
or like
Yes. But I think,
Yeah.
Harrison, what are the people called that believe the earth are flat? Flat earthers. Is that really the
so
name?
technical. That is
Yes,
the name
he
of
says
it.
that's
Yeah,
the name. I knew it was something.
we're
like
round
this.
earthers.
Yes. And so there's a lot of them.
Yeah. People think that like there's a diagram and it's just like the earth flat and then it's just like a core basically. I don't know how to describe it, but it's weird.
I don't get any of it.
You should look up a
Like
picture.
I
know.
was, how I don't
You
get
fall
it.
off the edge.
Right.
Yeah.
Where's the edge?
Right? Isn't that what they used to think? The people
it's
that were sailing
round-
the seas back when they didn't know where all the countries were and they were sailing from like Columbus.
They would
and
just fall off.
they would fall off.
Yeah,
That's
I
what
don't
they
get
were
it.
like. You can't go any further because, they as far as your eye,
Yeah.
but they just kept going and going and going.
Mhm.
I don't get it.
I want to look up reasons.
Yeah.
Just all things I just don't.
Worry about.
Yeah.
I know. Me neither.
We have enough going on.
Yes, we do. Absolutely.
Okay, but it's a good topic to just
Our opinion
play
isn't
around
going to
with.
change anything.
All right. Do you believe in ghosts, Devyn?
Why? Yes.
Wait, have you had any spooky experiences?
No, I've not had a
Oh.
Yes.
You have?
What?
So it's going to sound really stupid and cliche, but it happened. So,
Sounds like a story.
So my uncle's neighbor, they don't live in this house anymore, but when they did, I babysat their little girl, and two things happened. So this first one is really stupid, but the garage was closed and the rakes on the wall kept moving. Like the rakes hanging like wind, but everything was closed.
Oh, that's
Then
really
the
cool.
second
you were
thing-
there?
Yep. And then the second thing that happened is we were down in the basement. I should probably preface. Before they moved into their house, someone had committed
Suicide
bad
there?
things,
Okay.
yeah,
Mhm.
to themselves in their basement. And so in the basement, me and the daughter were just playing something, and she stopped like dead in her tracks and just stared at a corner and said there was someone there.
Oh, weird.
I just
Like
literally
it
just got
sounds dumb,
goosebumps.
but like it happened, and I was like, okay, we're gonna go
I don't
upstairs
like
now.
that at all. I would leave the house.
Yeah, they happen on different days, but it was
I
still
Yeah.
like
I never would have gone back after the first incident. I don't
yeah,
think.
yeah.
I
It
would've
was
gotten in my car
It
and
was
driven
very
away.
unsettling.
How old's the girl?
She was like 4, I
And
think,
how
at the
old-
time, 4 or 5.
How old were you?
13.
Oh my god.
Yeah. Yeah. I was going to say, Harrison knows probably the story I'm going to tell about this, but he was like 3 and my grandfather had died. My grandmother had died. And we were out of town and at a conference, veterinary conference, and my parents were watching him. So my parents went back to my grandmother's house where all my dad's siblings were gathering, and they had Harrison with them. So they were all gathering at my grandmother's house, and they were outside the door. And they opened the door, and Harrison said, "There are ghosts in here." And my mom and dad were like, "Well, grandma just died, da da da." And he was like, "No, there's someone sitting in the rocking chair or whatever." It was really like, because he was 3, like
Yeah.
it's not anything on his radar.
No, it was the same instance with the girl.
Why
I was
was
like,
it-
why would they
Yeah.
make something like that up?
I feel like they always
Like,
like
kids
they're
don't make-
notorious for picking on young children.
Well, I don't think that they're picking on them. I think
well,
that they're
like picking
kids
them
can see
out,
them.
like
because they're more open. They don't
Yeah.
have like, they're not like
they don't have
closed
like,
off to like the
they're more-
biases or
they're
closed
more
off to the idea. So
vulnerable and-
they're more open to
Oh
that
my
being a
gosh.
possibility.
Wow.
And so it was really, I thought it was really cool. I was like,
I'm gonna
oh,
have
wow,
nightmares
you're gonna see my
tonight.
grandpa. He's sitting in the rocking chair waiting for my grandma.
Aw.
So yeah, it was
Yeah.
really,
Yeah,
it was really interesting.
I believe in spiritual warfare and
Mhm.
angels and demons and stuff. Like,
Yeah.
Mhm.
there's that going around us and happening and fighting
Mhm.
and stuff. So I guess if you consider that ghost, then sure.
I was gonna say
Mhm.
yeah.
But yeah, like, I feel
Mhm.
like you can sometimes feel presence of
Right.
both good and bad. And
Yeah, I wouldn't call them
Whatever you
ghosts. I'd
believe.
call them just like spirits.
I guess now that we're talking about it, my sister had an experience. Her cat had passed away, and then she claimed that she felt like a cat rubbing on her while she was sleeping.
Oh, speaking of that, Amber has seen cats in the hallways here before when she stayed overnight.
What?
Like walking through the hallways. This is too much for me. Well,
I was
how
like,
many?
I cannot stay
I
here
mean,
for overnight.
how many
care
cat
now.
spirits are probably stuck here and animals? Like, and Amber has seen she has seen a cat multiple times, same cat on the same night. Seen them walking in
Oh
the
my
hallway
God.
by
Scary.
Terry Hindenburg's office.
Yeah.
Are you crying?
I don't know what.
Because she feels the cat spirits around her.
I mean, this stuff can get really creepy.
Okay,
I'm
If
done
you
now.
get into
Sorry.
that-
Okay. Fine.
It's my kind of crying.
Don't
It's fine.
Don't stay here by yourself.
She's never going to be able to do technician treatments at night now. Great.
No, this
Good job, Courtney.
It gets really intense, so I get it.
But I think those are the happy cats. Those cats are happy. They like to be here.
Yeah.
They felt happy when they were
stayed
here.
for a reason.
By chance, we're...
This is Harrison's fault. He made the question.
Oh, God. All right, we better move on.
Yeah, let's
Case
go.
collections.
Oh.
I'm okay.
She's good. She's good. Does someone have water for her? Okay.
It's fine.
Harrison's getting her
You need
water.
tissue
Okay.
and water, please.
We need tissues. We need water.
Hide.
Mayday, mayday. Hit the button.
Somebody press pause. Press pause.
Oh my god, I'm so sorry.
I mean, yeah.
Oh
Let's
gosh.
talk about something happy.
You know what though? I've got to go back to this for just a second.
Stop.
I have to. I never even thought about that as a place where
Spirits are
the
stuck here.
right? Or maybe they
Yeah.
just, like I said, I don't know if they feel like they're stuck here. Maybe they genuinely are here supporting everybody else that's here.
Yep.
That's what I'm going with.
Yeah.
Speaking of angels, they're all over the place
Yeah.
here.
Yeah.
right.
Oh my gosh! Now this
That's
is
what I was
amazing.
gonna say. It's just angels
Thank you.
and
Yes.
people watching.
Yep.
People, animals watching over us, and
Yeah.
they're there to protect us if the bad ones come around.
Yep.
Yeah.
It's amazing.
Just gonna.
Yeah.
Okay, case collections. On to case collections.
Okay.
You go first.
Well,
Okay, I'll go
kinda
first.
sad.
Do you want me to go first? Yours
Yeah,
is
go to-
sad?
I'll just
You-
get the sad.
No,
one.
you go first because then the camera will be on you while I demo. Here's a way.
Okay.
That's genius logic. Good
That
job,
was very
Dev.
genius.
Okay, so my case is a 10-month-old male neuter domestic short hair cat who presented for not eating great and just doesn't seem like himself. And he is breathing faster than he should normally breathe and maybe a little more raspy than when he should normally be. And the client brought him in for those reasons. On physical exam, we looked at him, and he was a young cat, so you expect them to be pretty active in the room. They should be up and down and at least not sitting perfectly still on the countertop on the exam table. So I knew right off the bat when walking in, okay, something's not right. He's just not himself. And you know how they have that sick sitting position they sit in? They always like to sit, and so I was like, all right, this isn't good. So she told me a little bit more about kind of where she acquired him and how long she's had him. And then on physical exam, he had labored breathing, which was definitely there. So he was doing a lot of up and down breathing. He was pretty well fleshed, but he had lost some weight. You could tell that he wasn't his normal weight. And so then we proceeded to take x-rays of him, and he had a ton of pleural effusion.
No.
I know. It was sad.
Which is
Free fluid in his chest cavity. So his lungs were floating, and he couldn't breathe very well. That's why he couldn't breathe very well. So he was concentrating on breathing and, just sitting, basically trying not to overexert himself.
yeah.
And so we, with the technicians, tapped his chest to relieve a bunch of fluid. We got about 200 mils off of his chest
Wow.
to provide him some relief. But ultimately, unfortunately, there aren't great things that cause pleural effusion, meaning the prognosis is poor no matter what the cause.
Mm-hmm.
We're assuming that it's FIP, which is feline infectious peritonitis, which can present as a wet form with pleural effusion.
Mm-hmm.
But we didn't send off the fluid, but that's what we're thinking because of his age and some of his other lab findings on his workup.
Mm-hmm.
So he's still here right now. And the owner is, just providing good quality care and loving him for as long as she can.
Nice. Yeah.
So, I don't see a ton of FIP anymore, but
No.
Yeah.
if you by chance have a cat that's been diagnosed with FIP, there's that really cool Facebook
Oh gosh, I don't know anything
group.
about
I think
it.
it's called FIP Warriors or something along those lines. And they're like a support group for people that
cool.
have cats with FIP,
Sweet.
because there is the new oral drug, which isn't on the market for FIP, but they're using it for FIP. Does it sound familiar to you?
I honestly have no idea.
I can't think of the name of it off the top of my head.
I know
but
Schmoke has had an instance.
yeah, you have to
or-
get it from Canada or someplace
Yeah.
else. And they've had some luck with treating it, but it doesn't have a great prognosis.
Yeah.
So that's my case.
Okay.
It was
Okay.
interesting.
Yeah, that is
Interesting.
interesting, especially such a young baby.
Yeah.
Baby.
I was really hoping
Bummer.
he had asthma.
Yeah, right. You can treat asthma.
But-
Okay. Well,
Mythbusters.
mine's also.
Do you want me to break up the sadness?
Yes. Okay,
Oh.
sure.
Is that okay?
That's fine.
Okay,
Mine's
we'll take
kind
a
of
break.
happy,
We'll
too.
take a break from the sadness.
Okay,
for a
not
second.
necessarily
So then we'll
happy.
go
End on a
her
happy note.
and then her.
Yeah.
Okay, great. So this is a Jones patient. He's a long-term Jones patient. He's a little old Maltese little guy. He's super cute. And he came in just as he's here all the time. He came in for, I don't know what the problem was. I think it may have been just a recheck, just checking up on him, seeing how he's doing recently. And they found this issue months ago, but they had to trim it this time. He had a nail on his tail.
Nail on his
It's technically not a nail. It's just a whole. It's pretty much a keratin deposit, and it just keeps building up. So then it grows like a nail, but then you just cut it, and so it doesn't bother him. It doesn't hurt him or anything like that. They just maintain it like a nail, and he just sent him on his way.
It's funny.
That's
You know
it.
what's interesting is that we see those on tails.
Mhm.
They like to show up on tails.
Yeah.
Yeah, it's weird.
Yeah.
Usually I just feel like I always pick it if I see it. I
Yeah.
don't
Sometimes you
really-
can just like peel it off.
Yeah, yeah.
They always
I don't know
regrow
how
unless
deep
you
his was
surgically
or how,
remove
but
it.
yeah, I'm
Do
not
they
sure. But they
have-
just clipped it, and
Do they have blood supply? Because like I saw
At
the
the base,
video, I saw
think.
the video of her trimming it, and like she was like, "Oh, that's short enough." I don't know.
Not
I don't think
what's
so.
growing out away from the skin
Okay.
that you would cut.
Not like a quick.
Right.
They don't have that. Yeah.
No, it's not like a true
Interesting.
nail. It's just keratin.
Yeah.
Mm.
Yeah.
Looks like a nail.
It does.
Yeah.
Yeah, they're really weird.
because that
looking.
can happen on paw pads too, right? That's what
Yep,
happens
you
on
can
paw
see it on
pads.
paw pads.
Yeah, I remember when I first started, you were like, "We can cut that off," and I was like, "What? You want to cut the paw pad off?" I was like, "Okay."
I think on paw pads, don't they think it's related to a virus when the
'Cause
puppy or the
The
kitten is really
papillomas
young?
or
No,
No, the
hyper-
little keratin
like,
growths
it,
on
like-
paw pads. It's
Oh.
related to having a virus when they're younger.
because bulldogs usually get it, but I thought it was just a bulldog.
yeah,
thing.
I thought
And
it
then
was just
kittens can
I
get
didn't know
them.
of a virus.
Yeah, I didn't know.
No,
that.
I'm talking about those single solitary growths that'll come out
Oh,
of an
I
out
was
of a
talking about
pad.
just like bulldogs when they
Like the
have like
fray where
the
it's not gonna go
yeah.
down. Yeah.
Okay, okay.
Keratin,
Interesting.
keratin everywhere.
Mhm.
Love your keratin.
That was it. That's all I got.
In the hair.
In the hair.
Shall we keep going?
Yes, keep going.
Oh,
I'm the sad.
I'm happy to go.
No, you
I'm
gotta
the
end on a
sad.
high note. Okay, so this is one of my best friend's dogs, and she lives in Florida, but I feel like, we talk about our animals all the time, and I've met this dog. So she's had urinary issues. She's an old English Mastiff. Her name's Demi, and they've been dealing with that, dealing with UTIs. She's done everything under the sun. That's not really the case, though. Unfortunately, she was just diagnosed with osteosarcoma. And I think she's like 8 or 9 at this point. But my friend Courtney had said like they recommended euthanasia like ASAP. And I'm like thinking, I wonder why? Because yes, they're in pain. But she had been limping for a little bit at that point. And I don't know. I usually just say, okay, we can give them a little more time, not like
Right.
ASAP. Well, she
Right.
sent me the x-ray. The ulna on her right front, I think, is obliterated. Like legitimately
Like just
one
eating
wrong
away,
step.
and
Yeah.
she's gonna fracture it.
Yeah,
Oh my
exactly.
gosh.
Oh,
So they're so
God.
worried about
Yeah.
pathological fracture. And of course, at that point, that's just not humane.
Yeah.
And so I have the x-ray if we put it up on the thing. But yeah, I mean, we see bad osteosarc, but I feel like it's usually not to the point where like I can't find the cortex on
Yeah,
either
most of
side
the time we
bone.
can, like you said, give them a little bit more
Yeah.
time on pain meds and
Oh my.
give the owners more time to digest the news. But I'm
Yeah.
sorry.
So they're keeping her. Her fiance travels a lot, so they're just keeping her like really comfy, literally sleeping with her on her big
Mhm,
bed and like making sure she doesn't get up and move around, bringing food to her
Yeah.
and all of that. And they're going to euthanize her on Friday. But
Oh, I'm sorry.
yeah,
Gosh, those
that's why
big
it's
dogs
sad.
and their bone cancer.
I know.
Yeah, it's
And
very
it was out of
annoying.
note. She
The
said
giant
she had
breeds.
limped a little bit before Christmas. They did Rimadyl, didn't get better, which is why we always recommend x-rays.
That is like
but-
the classic
Yeah, I think that's
historical
maybe-
presentation.
I was gonna say it's always osteo. It just like shows up, and then you get whacked in the face with your dog has bone cancer, and then
Yeah.
they're
Yeah.
like osteosarc doesn't give you time to process.
No,
Well, and
it
it's
doesn't.
always like they don't respond to Rimadyl. Anytime if you're a veterinary student or a veterinarian out there or whatever, and you're giving dogs Rimadyl and they're older and they fit the breed and don't get a response because you think it's
Mhm.
arthritis, I mean, that just doesn't happen.
Yeah.
Mhm.
They should respond to Rimadyl or Librela. And when that doesn't happen, you got to be like,
We should probably look.
Yeah.
Well, and I would just imagine.
And that's why, to your point, why we always recommend x-rays if
Yeah.
we don't see an improvement.
I'm sure she didn't say, we didn't go into detail, but I'm sure she was so painful if the vet palpated that limb,
Yeah.
like,
Mhm.
Yeah,
It would have been
Oh,
bone
yeah.
pain.
Yeah. which is very, very uncomfortable.
Yeah.
yeah,
Even the nicest dog will try to bite you. So.
yeah. That was like who we had.
Yeah.
We couldn't keep his
Bruno.
pain managed very well. Yeah, yeah.
Yep. Big dog, mastiff too.
Mm-hmm.
Gosh darn.
Our
I know.
osteosarc is frustrating. But I did see. I think I told you guys about it at the TikTok I saw. A Newfoundland had
Oh, yeah.
osteosarc and they gave a Librela and he's acting great. Like he's
He feels
super
better.
comfortable. I mean, he still has cancer, obviously, but it just to give the owner more time. And he
Yeah.
responded
And so
well
watch
with
for
it.
the fractures because that's what happens.
Yeah.
Is like,
Yeah.
Yeah.
okay, that was mine.
Okay.
I love you, Demi.
Here I go. I have some notes. Is there still a okay? Okay. Okay. So mine is a 1.5-year-old unneutered male Bernese Mountain Dog. He, just a note, he and his owners primarily reside in Florida, so they were just here visiting for the holidays, I think. But he presented for urinating blood, straining, and painful when sitting down. Upon getting more information from the owner, he wasn't licking his prepuce, he wasn't vomiting or having diarrhea, but he was very lethargic. When he got out of the car, he was very uncomfortable and his back legs were like super straight, walking weird, very uncomfortable. Got his temp, which was also uncomfortable for him, and it was 102.8, so like a low-grade fever. Dr. Dudley, this is a Dr. Dudley patient, and she asked the owner if he was used for breeding or whatnot. The owner said no, but he was still exposed to other dogs. And she also mentioned that she had had flu-like symptoms the week prior.
The owner, that is.
Yes,
Mhm.
yes. And that the dog was to be neutered when they got back to Florida a few weeks later. So Dr. Dudley did some diagnostics. We did a lateral radiograph, which showed an enlarged prostate with no evidence of stones. And then she did a prostate ultrasound, which also showed enlargement, but no evidence of cysts or abscesses. And then they sent out a urine culture and a Brucella PCR, which Brucellus is basically like a dog STD. That's my understanding of it.
Yeah.
It's a bacteria.
It's a
that-
bacteria. And
Okay.
people can get it, so that's
Yes.
why.
But
Yeah.
breeding dogs, yes.
Breeding dogs.
So
is
that's why
place.
it's important that he was not a breeding dog and that the mom was sick a week prior. The urine came back. Well, okay, so we started him on Enroquin, Rimadyl, and gabapentin. The urine came back negative, but Dr. Dudley suspects it was a false negative. And then the Brucella PCR actually came back negative too.
Which is good.
And when we gave him those results, they said that he was doing great. He was controlled, so they're still planning on getting him neutered. And then if his issue returns, then they're going to treat it. But no Brucella.
Which is good because you have to go through the state. You
yeah.
have to report
It's like
it.
this
like
big-
it's a big deal.
Yeah.
It's portable
Especially
disease
because
is
it's
like,
zoonotic.
yes.
No
So-
fun.
Yeah. And I think we had the neurologist come talk to us in our clinic, and she said that she had seen some cases.
Mhm.
So I think that was why it was on our radar too.
Yeah.
'Cause
Yeah.
Usually
And because we're dealing mostly
Bless
with
you.
neutered patients.
yeah.
You
Right.
know. Bless you.
Thank you.
So I think that the available population for us to manage, we just don't see it. I mean,
Right.
because we don't manage intact
Mhm.
patients very often.
Yeah.
But yeah, it's definitely.
Yep.
His testicles were hurting and his prostate were
Yeah,
hurting.
he was
Yeah.
uncomfortable.
Poor
Walking
guy.
like those hurt.
Yeah. Yep.
Poor guy.
I know. You feel horrible for him.
Yeah. So
But I'm glad he's doing better. It's
Yeah.
a cool
Mhm.
case. That's a cool case.
Yeah, it's interesting. Okay, on to the questions.
Okay.
What is the ugly
Listener
truth?
questions. Here we go.
Oh, I was jumping in.
Oh, do it.
Okay.
Yes.
Wow.
What is the ugly truth and or make or break moment in this field that set people aside and actually making a career out of vet medicine?
Dun, 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 dun.
I guess I'm
Dun,
kind of
dun,
confused.
I agree. Is it like they get into
Like they
it
just-
and then they don't like it?
Yes,
Or
that's
that
what I'm-
pushes them out of the field?
Right.
Or
How do you become successful?
right.
Or both?
Yeah,
or they
so
don't pursue it because they find out money's not the best in it? Like
What is the
it
ugly? Yeah. So
I
what
don't
is the ugly
understand.
truth
I think
that basically set people aside and actually making keep them from wanting?
so they try it and then they're like, nah.
Yeah.
Okay.
Or that they are thinking about it and then they learn this truth and they're like, nah,
I feel like
thanks.
money is probably a big deal.
If you get in it, I think mental fatigue.
Yeah, I was gonna say
Mhm.
mental stuff for sure.
Compassion fatigue, I would say, is 100%
Yeah.
number one.
Mhm.
Burnout.
Yep.
Mm-hmm.
And then to your point, Devyn, money.
Yeah.
Especially
think
based
that's
on student loans. If you're a veterinarian or veterinary student who had to take loans for undergraduate school, now you
Yeah.
have loans for
Mhm.
veterinary school,
Mm-hmm.
and our light went out. And you then have a salary that can't meet the
Yeah.
demand, the debt
Yeah.
ratio of, I mean, that would be a reason why you'd be like, nope, I can't choose this field.
Yeah.
Mhm.
Yeah.
Or kick
That's
you out of the
probably-
field because you're like, I got to pay my bills.
Yeah.
And inflation right now is not helping
Yeah.
anybody
Which
either.
adds to your compassion fatigue. I
But
think.
yeah, in terms of like being in the career and then like getting burnt out, I think like where you work and the people you work with has a big contribution to
Mhm.
that
I agree.
and how they take care
Yeah.
of you, how you're appreciated.
So that's what you're
yada,
talking
yada.
about, things that make it, like things that,
Well, it could make or break. Like if I work somewhere for a while and then I
Because
don't
one
know,
clinic
just,
could
like, if
ruin
I'm
it
not
all for
treated-
you because you
Yeah.
may not think there's something better, and then you're just like, nope, I'm done. That was too much.
Mhm.
If you're
Right.
not treated great, I'm sure that would make some people.
like, peace out.
Mhm.
Yeah. I think
Or the opposite, if it's good, then
yeah.
Then that would
that
make
encourages
it.
you
Yeah.
to
Yeah.
want to do it.
Yeah.
I think to avoid beating around the bush, I mean, veterinary medicine like is mentally and emotionally very exhausting and difficult. And like there's a high suicide rate in our field. There is a lot of burnout in general, and there's not the right amount of resources for people to handle it.
Yeah.
And it's always like, we got to do better, but no one's doing better, which is very frustrating. And so you have to take it upon yourself, which is fine. You have to have that ownership of what you need for your life and stuff. But if you're in such a dark hole that you don't recognize it, it's just, that's where it gets frustrating when you don't, some clinics, some places, some schools just don't have the avenues or the resources to help. So I think that's, I don't know. I just think that that's such a huge issue in our field and maybe in human medicine too, I'm sure.
Mhm.
But like, there's nothing that's being done about it. I mean, yeah, there's maybe a school counselor.
Right.
Or they tell you, watch for this.
Right.
Yeah.
They tell you about it.
But, I mean, I
until
think
you're
in
in it,
general-
you have no idea.
There's no
Yes.
one advocating for
No.
And I think
no.
the people that enter the industry typically would have the characteristics of being like servants, like having servant hearts.
Sure. Yeah.
Then when you get destroyed on some days by clients because, and we've learned, we constantly are preaching, you don't know what's going on in that person's life. You don't know, what happened to them before they came in for the appointment. You don't know, trying to depersonalize,
Mhm.
Yes.
those types of experiences. But when they say hurtful things out of their own hurt,
Mm-hmm.
it can be hard.
It's
Mhm.
hard
to be able
doing
to
that.
put that
Yeah.
aside, and you need to put it aside, but
Right.
yet you keep coming back to like, I'm only trying to do my best. I'm trying to do my best. I'm not intentionally telling you something that you don't want to hear or telling you something that
Yeah,
you don't,
right.
like I'm, and so I think that and there are things like time that only can make those situations better, but you sit and stew on them as the
Yeah.
person handling the case or
Mhm.
the people handling the patients or, and so I think that is mentally exhausting.
Yeah.
Mhm.
And depending on the area where you live and the clientele and what their expectations are, and I mean, all of that.
Mm-hmm. And you try not to take it personally, but
Some days it's hard to do
Yeah.
that.
I mean, you're human. You're gonna sit and think about it a little
Yeah.
more when you go home. Like you're gonna be really heartbroken about it. You're gonna be sad. You're gonna be worried. Like it's just one of those things where we're human too. Like, and people, I think, unfortunately, it goes back to we're only in it for the money and we don't care about their animal, and that's not the case at all.
Mhm.
And I think that the other thing too that we deal with that and other medical fields don't deal with is euthanasia. We
Yeah.
are the field where we have to sit and decide and talk through and use our best education and use our best knowledge, resources to tell them if this patient, this animal's life that can't talk to us is affected or if
Mhm.
it's suffering. And then we have to tell that to the person connected to it. And then we have to then soak in those person's response, their emotions to it. So that's a lot of baggage that we also take on.
Yeah.
Not saying that, again, human doctors, human medical field, like they have their own set that they
Right.
deal with
Yeah.
humans. But because we deal with euthanasia
Yeah.
and we are the ones acting on that, that's where I
Yeah.
think it's a whole nother set of mental health you have to watch
Mhm.
out for.
Then we take their grief into our own.
Yeah.
and-
So
Yeah.
Yeah.
That's probably all the hardest part.
yeah. I would also
for sure.
I would also say, speaking from my experience as a tech or a technician, another thing that's really frustrating and that can also, I feel like, in certain cases cause burnout or cause you to just not want to do what you do anymore is, which I get it, people are not educated. I'm not mad at people for not knowing. And I give all the credit to human medical workers because I could not do what they do. That's incredible. But I feel like we don't get the recognition that we deserve like they do. It's just sometimes it like constantly beats you down because you're like, oh, you don't do anything. You get to go to work and play with kids and puppies all day. And you don't have to, like, the doctors do the euthanasias, but like, I give you guys the credit too, but we do the aftercare. Like, that's not easy either.
Yeah.
We talk to the client. Like, so it gets really frustrating when people don't understand like the importance you have as well.
Yeah.
That's another thing.
It's just not talked about enough. And it just is very infuriating in that aspect of things. But so talk about it more. Talk about your feelings.
Talk.
Talk to someone.
Yes. Everything's not fine. It doesn't have to be fine.
It doesn't have to be.
Say when it's
but
not
it will
fine.
be fine.
Say when it's
It'll
not.
get there.
That's right. Yep.
Okay.
We're
Now
done with
I'm
that.
Okay, next question.
Last question.
In a previous episode, you guys mentioned the different types of fields you could go into, like equine or marine biology. Is there a stereotype about or a specific type of person that fits best into each field? And these questions come from @Sammy Carmona. Cool name. Okay.
I don't know if there's a stereotype necessarily, but I think like people that grow up with horses are more likely to go into equine medicine. And then I don't know about marine biology, but maybe like people on the coast are more likely to go into that field. I don't know. That's my 2 cents.
I think there are people who are more comfortable behind like a microscope or behind the desk and stuff where they don't have to have that personal one-on-one with
People.
pet owners and people in general. So
yeah, if you don't, like, I would say people that are outgoing, like that aren't necessarily introverts are probably out in general practice.
Yeah.
Wouldn't you say that they're more?
Yeah.
Because they're more talky and they like to spend time with people. And so then, because that's what you have to do over and over and over and over again. I would say that people in general, sorry, my stomach's growling because it is that time. People in general practice probably also like to solve problems.
Yeah.
You know, so they're interested in problem solving and their day changing from day to day.
Yeah.
Whereas people that like consistency might be doing like specialized practice, like being an ophthalmologist or a dermatologist, or they like the same thing every day.
Yeah.
They like to be really good at the same thing every day.
Yeah.
We need a
You know?
variety.
That's what I was going to say is I feel like sometimes the way people's brains operate, like I feel like in general, a lot of veterinarians or people in the industry are type A, but they're still like very more analytical type A's or, I mean, not everyone's type A, but you know what I mean? Like the way they look at the problem and, you know, maybe orthopedics, they like more of that physics and math stuff to it. So,
or working with tools.
Yeah, exactly.
That's fun. Get out that hardware, those hardware tools.
right.
Yeah. Get out the drill, get out the saw.
Yeah.
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 I got nothing.
I agree with all that.
No,
I don't think that there's a best fit. I think you just have to find what you enjoy the most in the vast number of options you have.
If you like swimming, maybe you'll like marine biology. I don't know.
Well, when I was doing all that marine work and I finally decided I wasn't going to do it, and I was with the penguins.
Not snorkeling, but
shoveling the
diving.
penguin shit. I was like, I'm not going to sit and do research all day.
Yeah.
Right. Yeah.
Like that is I will stab my eyes out.
Yeah.
Yeah.
Now I wanted to work with that specific type of, or those specific types of animals, but that I realized was not what was going to be happening. So it was going to be a lot more research than hands-on.
Yeah.
So I think paying attention to all of those things.
Yeah.
When you're trying to contemplate what is it that.
Job shadow.
Yeah. Job shadow is huge. Yeah. If you're not sure.
There's so many options.
There's so many things you can be as a veterinarian. For sure.
Experiment. Try them all.
Yeah.
Yeah.
I still would like to work with sea life animals. I think it's so fascinating.
Yep.
I've been intrigued in water animals since I was little. I love them.
Yeah.
Yeah.
You just need to go job shadow Kristen down in Florida.
I know.
That'd be so cool.
I tried to get into the zoo, but it was a big process.
Yeah.
Oh, yeah.
I tried to extern there for college, and it was, oof.
It's really hard to do
because you have to volunteer
in zoo medicine.
Yeah, you have to volunteer for so long at the zoo, and then they'll let you do certain things. Yeah, it's a long process. It'd be worth it though, but
Yep.
Okay, well,
Okay.
hopefully we answered your questions, Sammy.
Yes, great question, Sammy. Thank you for sending them in.
Okay, thank you so much for tuning in to another episode of the Veterinary Roundtable. Remember, send in those questions and be sure to follow us on all social media platforms at All Star Veterinary Clinic. If you enjoyed this episode or a previous episode,
Why are you laughing?
leave us a review on your podcast provider of choice. We'll see you in a few weeks for the next episode of the Veterinary Roundtable.
Stay tuned for King's Mystery Bag.
Yes,
Oh,
King's
yeah.
Mystery Bag coming
Yeah.
up, baby.
Okay, thank you all.